In this video, we will show you how to give medication under the skin using the small soft tube called a Saf-T-Intima. This medication is given only when your loved one needs it. It can help with symptoms such as pain, nausea, breathlessness, or restlessness. We will guide you step by step so you feel confident and supported. Before you start, wash your hands well with soap and water and dry them thoroughly. This helps keep your loved ones safe from infection. Look at the area where the Saf-T-Intima goes into the skin. It should look clean and healthy. You should not see redness, swelling, a rash or bruising, moisture or leaking, a dressing that is lifting or peeling off. If you feel the site is warmer than usual, if something else doesn't look right, please contact your hospice before giving the medication. Before giving the medication, check that you have the correct medication, the correct person, the correct dose, the correct way of giving it, subcut under the skin, the correct timing. Check how often it is allowed. Use the label on the syringe and the medication chart or written guidelines from the hospice nurse to guide you. The syringe will attach to the needleless valve where the medication enters and travels up the line to be delivered under the skin. Please note there are multiple variations of the needleless valve. Your loved one may have a different valve, but they all work in the same way. Clean the end of the Saf-T-Intima with an alcohol swab. Let it dry for about 30 seconds. This helps prevent infection. You will have a pre-filled syringe from the pharmacy. Twist off the coloured cap at the end of the syringe. Keep the tip clean and away from anything that could introduce germs. Attach the pre-filled syringe with the medication to the needleless valve by first pushing and then twisting it clockwise until it locks on. If the line has a little clamp, open it now. Press the plunger of the syringe in slowly. The medication will move through the tubing and gently enter under the skin. If the plunger is very hard to push or you feel something is wrong, stop and call your hospice or district nurse provider. When you are finished giving the medication, twist the syringe off in an anti-clockwise direction. Next, give 0.5 milliliters of normal saline to flush the line. This ensures all the medication is given and can be absorbed under the skin. You may have been provided with a large or small syringe as shown here. This syringe may be pre-filled or you may need to fill it. To prepare the syringe, twist the top of the saline and twist the flush syringe on. Flip the syringe so that the saline is on top, then draw 0.5 milliliters. Twist the syringe off, then twist onto the Saf-T-Intima. Press the plunger of the syringe in slowly. The saline will move through the tubing and gently enter under the skin. Please write down the name of the medication used, the time and dose you gave on the medication chart. If needed, subcutaneous, under the skin, a medication administration record is provided by hospice. If this is not available, please document it in a diary or notebook. This helps the healthcare team understand how often the medication is needed. It is very important that everyone involved in the care of your loved one is aware to document any medication given under the skin. If you ever feel unsure, if something doesn't seem right, or if the medication is not helping, please phone your hospice, general practitioner, or district nurse. They are here to support you.